Good afternoon. I am Dr. Kailash Kothari. I am interventional spine and pain physician at Apollo Spectra Hospital in Mumbai and also director of Pain Clinic of India Private Limited. And we are working here in Apollo Spectra Hospital and managing a lot of chronic pain patients. So today I am with you for informing and giving some information about what is pain management, what are the minimally invasive non-surgical and some minimally invasive surgical procedures which are helpful for managing the chronic pain, and this may help you if you have or somebody of yours relative or your friends or loved one, they are suffering in chronic pain and they want to avoid a major spine surgery or any other joint surgeries. So basically what we are going to do today is going to discuss something about what is spine pain, what is the cause of it, what are the different pain generators, how pain is developed and how it can be managed. So let's come to a basic about back pain, neck pain, and everybody in our society at some point or other in their lifetime they have some or other back pain, neck pain, and it is very common. It is one of the most common condition for which people attend the hospital and go to doctor. Now, why it happens? There are many other structures in the body which does not cause any pain, but why back pain and neck pain is so common? That is because whatever weight of the body it is carried to the floor, it is all carried through a central axial system or central bony system, and what is in the center? It is spine. So the weight is carried by the neck, thorax and lumbar spine, and it is distributed to both the legs and carried by different bones in the legs to the floor. And at the same time we should remember that our body is not a static. We are always in dynamic form. We are walking, we are sitting, we are changing position, we are bending, we are doing extension, flexion, side bending, side rotation, everything, all the actions are happening on the spine. So when we are bending forward or bending backward or on the side, we want to pick up something from the floor, what is happening? When we are bending down, there are certain muscles which are acting on the spine, they are contracting and we are pulling our body towards the floor. But at the same time, the opposite side of the muscles, they want to balance, okay, and they are relaxing. So one muscle is contracting on the spine, other is relaxing. So there is a constant pull and push from opposite side. So that causes a rapid degeneration. There is always spine is under some or other form of tension. There are lots of ligaments and muscles which are there to support the spine. At the same time, these muscles, they also provide flexibility. So the bones, muscles and ligament, they make a full framework of the back and neck or the spine. Whenever there is a weakness of one or other structure, like ligament or muscles are weak or bones are becoming weak because of osteoporosis, the balance is, this is very fine balance, and this balance is disturbed. So when you have a muscle which is supporting the low back, so we have core muscles, there is the abdominal muscle which is holding the spine from the front, there are back muscles which are holding the spine from the posterior side or back side of the spine, and there are core muscles which are also thigh muscles and the back of the thigh muscles which are holding the back bones properly. So when any of these structures they are getting weak, the balance is lost. When the balance is lost, the weight distribution to the spine is unequal. When it is unequal, it causes stress on one side of the spine, and it can be various structures. So I am going to talk to you about various structures which can cause pain. But basically we need to understand, whenever there is an imbalance of these supporting structure which are muscles, ligaments and bones, there is beginning of the back pain. And if you do not correct in initial phase, by doing exercise and by recognizing that you are getting obese, or you are smoking and it is causing weakness of the muscles, you are drinking too much of the alcohol, you are going to weaken your supportive system for the bone, for the spine. So we need to understand that, and we need to make sure that your lifestyle is good, your weight is in proper range, and you are going to do some exercise like walking, or maybe half an hour to 45 minutes daily walking will help you in making these structures strong, and you are going to improve your backbone and neck bones. So coming to the basic structure which everybody should know, why the spine causes pain. So this is one of the spine model I am carrying today just to make you understand. Is it visible?
Yes.
Okay, so it is visible. So what we have is, this is your spine. Okay, so now this is your disc. So what is there? This is the disc, and these are the bones. Between two bones there is a disc. When I am turning it, this is the front side of the spine, and this is the back side of the spine. We have various bony structure which are holding the spinal cord inside. So there is a canal. If you see this, there is a canal. Okay, so this is the canal in which spinal cord is lying, and there are nerves which are coming out. There are hole on the side. Okay, so the spinal cord gives the nerve which comes out and goes in the leg or in the neck. When it comes out, it goes in the arm. Now what is happening? Any structure which is not good in this, and it is causing compression of the nerves, it can cause pain, which is carrying through these nerves to arm or leg. Or if it is not too much of compression and slight bulging is there of the disc, it can cause only neck or back pain. It will not radiate, it will not go to arm or in the leg. So understand what is disc. So let's discuss about something about disc. Disc is nothing but shock absorber of your body or your spine. Whenever we walk, we sit, we jump, we run, there is a compression of these two bones. We always keep on jumping, and these two bones, they are compressed against each other, and the disc is the structure which will allow that there is no damage happening to the bones, because it is flexible. It is like a spring. It is like a shock absorber in your car. So you need to keep it in proper position and proper health. We have a central part which is called gel or nucleus. There is around the nucleus there is a fibrous tissue which is called annulus, and this annulus is very sensitive because it is supplied by a small nerves. Whenever there is damage to the annulus, it can cause severe back pain. Okay, so if there is any damage because of any reason, like you are working in the gym, or you just slip, or you sneeze very vigorously, or you cough very vigorously, if there is any weakness in this ligament, it will just break down, and you can have a stage 2. This was a normal stage. There is a stage 2 which is small tear in the annulus. So outer part is annulus, the gel start coming out, it irritates the nerve, and it can cause severe back pain. Right now it is not going out, it is not going to compress the spinal cord or nerves which are coming out. That's why it will cause only back pain. Stage 3 is when you do not take care, you do not exercise and do not lose weight, and there is a lot of weakness in the muscle and ligament. They are not able to hold the pressure which is getting exerted on the bones. The gel start coming out more, and it is going to compress the spinal cord and the nerves which are coming out, and it can cause severe inflammation of the nerves which are coming out from here. Okay, so if it is on the left side, it will cause pain on the left side. If it is on the right side, pain will be going on the right side, the side where the gel is coming out. We call this herniated disc or slip disc, or it can cause, some people call it sciatica. The sciatica is a condition which is caused by herniated disc. Now when the herniated disc is there, it can be in the center, it can cause pain on the both side because both the nerves are getting compressed, and if it is on left, it will cause pain on the left side, right cause right side. So this is the third stage, and many people who go in this stage may require some or other form of treatment. Okay, and in old age, very people who are very old, around 65, 70, they may have a degenerative disc. In degenerative disc, what happens? The height of the disc is totally gone. It is very thin. So two bones come very close to each other, and it can cause pressure on the nerves because the hole which is on the side becoming small and small, and we call it gap is reduced. Okay, many doctors tell you that the nerve is getting pinching because the gap is reduced. So this is the reduction in gap because of the thinning of the disc. So basically disc is your center stage, in the center stage, and it is our duty to maintain the health of the disc by doing proper exercise and making sure that you are not in bad habits in excessive form, so that the blood supply to the disc is proper and it is maintained well. Now suppose you have a condition which is even after taking care and you are taking care of everything, still you develop back pain or leg pain, or sometimes you develop neck pain and pain going down in the arms. This is called radicular pain, where the pain is traveling from spine, from the center, and it is traveling toward the periphery, to the fingers, to the toes, where whichever nerve is getting compressed, in that part the patient will have pain. Now there are various options to treat pain because of this kind of thing. One, medicines. Second is physiotherapy, and third is making sure that you do not hurt the disc by doing the exercise or by doing the activities which are going to damage the disc more. So coming to first, in medicine we give us simple medications which are in a proper dosage, which do not cause any damage to the liver or the kidney or causing any GI symptoms like acidity or ulcer. So we need to give drugs in a combination so that each drug is of small dose and it do not cause any side effect. That's our main priority, because and everybody in our society, they are very much aware that painkillers can cause kidney damage, liver damage, and can cause severe GI symptoms, gastrointestinal symptoms like ulcer or something, and can cause bleeding and can be very fatal. So it is very, very important that over the counter drug should not be used for very long time. So many people have back pain, neck pain, they just go to chemist and they take some or combiflam dena, you can get Voveran dena, and they take every day or very commonly they take, and over time they land in this kind of trouble. Now when you go to pain clinics, there you are given a proper dosage of the drugs, and there are many drugs now which are not that dangerous. They can be taken for a little longer time, and they are not damaged. They are not causing any damage to the liver or kidney or any GI symptom, which are very common with anti-inflammatory like NSAIDs. Okay, so you need to make sure that you, if you have a chronic pain, you do not take over-the-counter drug for a very long time and avoid the side effect. Because if you have one of the problem occurs, like your liver or kidney start failing, then it is very, very difficult life forward. People will have dialysis and kidney transplant, and very costly these are. So make sure that you do not fall in that trap. Make sure you show to your doctor at very early stage. Go to physiotherapist to do very good exercise, and you maintain your back health properly. Apart from that, when you start with medication, we always combine with some or other form of physiotherapy. What is physiotherapy? Basically, they have various techniques by which your back muscles, ligaments, and the bones can be strengthened. Okay, they will improve your posture. They will work on your muscles by doing guiding you to do various exercise. They will help you in maintaining the posture, how to use the desk, how to use the computer, how to how much to walk, how much to sit. When you are in acute pain, when you are in severe pain, these are the things which will help you in managing your pain properly and increase your exercise over time and get back to your life again. So they will not start with a very aggressive thing initially, they will start with smaller things and then keep on increasing till you become very fit. So exercise is one. They have various electrical modalities, they have various things like acupuncture or taping or manipulation. There are various techniques like McKenzie. So there are a lot of advances in physiotherapy also, and our team at Apollo, they are very much advanced in that, and we do real good work, and I'm happy that most 90% of our patients just get better with medicines and physiotherapy alone. Okay, we don't need to go for surgery or major interventions like pain management interventions. So next stage comes when your the medicines and physical therapy is not working, and you have pain which is disabling you. You are not able to go to office, you are not able to do household work, you are not able to concentrate on your family, not concentrating on yourself, on your children, and there is a lot of psychological effect because of that. You are becoming irritable, you are becoming not focusing on your family and your enjoyments. You are not able to go to any function, so everything is affected. Your life is stopped. It is stopped because of the back pain or neck pain. In this situation, normally we have techniques in spine and pain management where we can reduce the inflammation, reduce the pressure on the nerve by many techniques which are non-invasive or non-surgical. There are injection techniques which are image guided. We use X-rays, live X-rays and sonography to guide the injection to a proper area where the nerve is getting compressed. So these are few of the injections you might have heard. Now for pain management, there are a lot of awareness. People know, and they always come to us, say I have this MRI which was taken, I have gone to 10 doctors, still pain is not relieved. I have heard about this epidural injection or facet joint injection or injection which is used to burn the nerves which are supplying this painful structure. So yes, we do those procedures very commonly, and there are a lot of patients who benefit with that. So most common thing what we do is, whenever you have this kind of disc prolapse, or this is the gel which is coming out and compressing the spinal cord, what we do is an injection in this area where the nerve is getting compressed. We call it epidural injection. That injection can help you in reducing the inflammation and reducing the pain because of that. Once we reduce the pain-free period will give you a lot of time to do exercises, improve your muscle strength, your ligament strength, posture, and go back to normal. Most of the time you can avoid major spine surgery with this injection. If your pain is because of the joint which is on the back side, these are the facet joints. If you have upper bone and lower bone, there are joints behind, and these joints can also produce pain, and we have various technique called radio frequency ablation technique for that. So that your doctor or pain physician will decide whether pain is coming from the facet joint, it is coming from the nerves, it is coming from the joint, from where it is coming. Now with injection, 90% of patient can get better and get back to the life. Problem is, once you get better, you are not continuing the exercise, you are not taking care, your posture is not correct, you keep doing the things like lifting weight or driving bike in an inappropriate way. So there are many conditions which do not improve with your spine and pain management interventions like injections, physiotherapy, and even after trying a lot, many people do not improve. So those are the cases where we have little bit more advanced kind of treatment which are still minimally invasive. They are not much lesser than surgery, much less costly, and do not require any hospitalization. and that's the main advantage of pain medicine, that you are going to get better with simple things, quickly get back to office very fast, get back to your work very fast, and you can have a pain relief instantly. Okay, so if your epidural injection or facet joint or RF ablations, these are not indicated, or you are not getting better with those things, there are things which are called intradiscal therapies, there are things which are called endoscopies, and these are the techniques which are stitchless, minimally invasive surgeries which can be done at pain clinics at Apollo Spectra Hospital. We are also offering many of the newer therapies like regenerative therapies like platelet rich plasma, dextrose prolotherapy, and there are many more therapies including acupuncture, which is it's very minimally invasive, and it's very less pain. There is no pain at all. So depending upon what kind of pain you are having, depending upon whether it is what chronicity it is, depending upon how much disabling it is, we always decide the best for you. And whatever disc prolapse, at whatever stage you are coming with, we are equipped well to manage your pain and make sure you get better within days, and at minimal cost, and without much suffering. That is main thing, and I'm sure you will have many questions, and this is one of the aspects we treat at pain clinic. We also treat many patients who are having cancer related pain, who are having joint related pain like shoulder pain or knee pain. These are all done with minimally invasive injection therapies. We have patients who are coming with trigeminal neuralgias or in many other nerves which can cause severe chronic pain. We do that treatment for that, and I'm sure that this video will be helpful for you, and you will have many questions which we'll be happy to respond to. And please do write to us in the inbox, and we will definitely get back to you with a proper answer and quick answer. Thank you very much. Thank you for listening.